Breathing tips for people with COPD or chronic obstructive pulmonary disease. Tip 1. Stop smoking. Long-term exposure to environmental pollutants can cause COPD like smoking. By the time someone gets COPD, their lungs are already damaged, but if they stop smoking, they can reduce future harm. Tip 2. Take medication. It is important to take medication, and if there are problems, patients should talk with their doctors. Tip 3. Mind your weight. People who are very sick with COPD use so much energy to breathe that they can have problems gaining weight. They often need to eat enough to gain weight. But if people are overweight, shedding excess pounds can improve their breathing. Tip 4. Avoid pollutants. Like people with asthma and other lung conditions, COPD patients can be affected by things in the environment: fumes, strong perfumes, pollen, dust, secondhand smoke, and construction sites that can exacerbate the disease, causing flare UPS and breathing problems. Tip 5. Stay healthy. Avoiding big crowds and people who are sick, calling a physician in the early stages of a cold or flu, and getting flu shots annually and pneumonia vaccinations about every 5 years. Tip 6. Sleep well. A lot of people with COPD also have sleep disorders such as sleep apnea or hypoventilation, breathing that is too slow or shallow. Signs of sleep problems to watch out for include feeling unusually tired all day, falling asleep during the day, morning headaches, and excessive snoring. Tip 7. Go for pulmonary rehabilitation. Everyone with COPD and, in particular, people who use oxygen or have shortness of breath when doing daily activities can benefit from pulmonary rehabilitation. Tip 8. Do breathing exercises. There are 2 main exercises that are practiced in rehab to help people with COPD improve their breathing. The first is pursed lip breathing. Pursed lip breathing helps regulate this problem. To perform this, sit comfortably and inhale deeply through the nose. Purse lips, as though whistling, and breathe out 3 times longer than the in-breath, but do not force the air out. A second exercise is diaphragm breathing. This technique helps strengthen the diaphragm muscle so people use less energy when breathing. To perform the exercise, lie on the back with knees bent, one hand on the upper chest and another resting on the abdomen. When inhaling and exhaling, keep the chest as still as possible and use the stomach to breathe. Tip 9. Get active. Though someone who can't breathe well may not feel like exercising, it is one of the most important things people with COPD can do to improve their breathing and overall health. Exercise does not directly change a person's lung function, but it improves muscle tone and cardiac function. This allows oxygen in the blood to be delivered more efficiently to the muscles and increases stamina. Tip 10. Get oxygen therapy if your COPD is severe. The one daily treatment that is proven to prolong life for people with severe COPD is oxygen. Click the link below or follow this link: https://askthenursexpert.com/category/COPD-chronic-obstructive-pulmonary disease for more breathing tips for people with COPD or chronic obstructive pulmonary disease.